Welcome to Healthcare on My Mind, a podcast by Georgians for a Healthy Future. Today's episode brings you insights from people engaged with Georgia's various Medicaid programs, including Pathways and Postpartum Medicaid. We will hear from a range of voices, including 2 beneficiaries of Medicaid, a medical student, and a practicing physician. Paul Michael, an essential worker skilled in multiple trades, including electrical work, truck driving, and maintenance, talked about his appreciation for affordable care options and his frustrations with the digital barriers encountered while assisting his aging father. My first question for you is to talk just a little bit about how you heard about the Georgia Pathways to Coverage, or Pathways, which we'll call it for the duration of our conversation. How did you hear about that program?
I heard about it signing up through the SNAP program, my food stamps, and I went ahead and clicked on, sign up for Medicaid too, and they said I was eligible for the Pathways.
Is it meeting your unique needs, your healthcare needs?
I can make appointments, and they tend to be, fairly timely about getting me in there. And they have different doctors, so I can find them closer to me. As a matter of fact, I'm in the process of trying to change one right now. It doesn't seem to be that difficult. You just have to find one that accepts the peach care, and they get you signed up. If I'm not happy with one, then I can change, because I'm actually changing right now as we speak. Getting one that's a little bit closer to me.
He describes having one issue.
What it was is I never actually went to my primary care physician. Had not ever had a single appointment with him, and when I actually did go in there, they said there was 2 times that I had that I owed $50 in late fees or what have you, and that I already had a chart, and I said, well, y'all must be mistaken, because I've never been here before, and I said any time that I canceled, it was within 24 hours, but I would just get like a recording, and I left a message, and said, why I was not going to be available. I don't know if it was the answering service or their, online, recording or what have you, but, according to them, I owed money, and I said, I don't see how I can, because, how I can even have a chart, because this is the first time I've been here. I said, I can understand maybe from this point forward, being charged $25 for, a no call, no show. But, the fact that I'd never been there, I don't see I could already owe you money, And it was totally unexpected to me, because I didn't have the extra $50 to, to pay for a fee that when I hadn't even been there before. So.
Sherthea Jackson, a resident of a small town in rural Georgia. As a mother of 4 and the full-time caregiver to her youngest son, who has a rare and disabling condition, she shared her first-hand experience with accessing health care, discussing both the benefits and challenges of accessing necessary care locally.
Well, my name is Hridaya Jackson, and I am from Fort Valley, Georgia, which is located in Peach County. It's a very small town. I think we're like 5 miles long in all. And as Panetta stated before, I am a mother of 4, and I'm a caregiver for my 3rd child. He's 6. He has a very rare disorder called INAD PLA2G6. So I'm a full-time caregiver for him.
Tell us a little bit about your experience with the healthcare system in Georgia.
Well, initially, with everything that I've ever started out with, I had private insurance because I did private security prior to my son getting sick. Once he got diagnosed with what he is diagnosed with, it's so rare I couldn't get any kind of nurses, caregivers, anyone to come in to see him. I couldn't even get the disability Medicaid for him immediately. It's like it took a while because they weren't knowledgeable about his disorder. So we were being denied. But my personal experience with it, aside from with him, I've always had, basically been on the pregnancy Medicaid. That's mostly my interaction with the Georgia Healthcare System. And honey, I'm not gonna lie, where we live, the amount of doctors versus the people ratio is huge. So attempting to find the correct doctor, I would have to travel at least 30 minutes or more sometimes, to see if I could find a specialist who could help me out in what I was going through with my pregnancies. And after him getting diagnosed with what he has, we're traveling at least 2 hours or more to get the specialist because it's so limited here. So that's basically been my experience so far.
Yeah. Paul, I saw you shaking your head when Sherthea mentioned the ratio of people to providers based on where she lives. So I saw your nod when she was sharing about that. So you're in Stockbridge, and
I lived in a small town from 2000 to 2015. I lived in South Georgia, where Georgia and Florida, Alabama all meet at, and it's 45 minutes, from anything. And if you need any kind of specialist or anything special, you got to drive 45 minutes, either north, south, or east or west. it's you know uh, and then it can be, like I say, anything that's special services or a specialist, anything that's a specialist or anything like that is going to be a drive. You want to count on that.
as I listened to Paul and Sherthea express the challenges of accessing care, I wanted to hear from the medical practitioners. Here's Hridaya Shah, medical student and clinic volunteer.
One of the most impactful experiences so far, kind of in understanding Georgia's healthcare landscape, has been volunteering and working as a clinic coordinator at some of the student-led free clinics in Augusta. So a lot of our clinics serve un or underinsured patients in Georgia, and these patients generally fall below 200% of the federal poverty level. And so simply seeing the number of patients that kind of come to our clinics to receive care was a bit of an eye opener for me in recognizing that there are so many that do not have healthcare coverage in Georgia. And then speaking with patients one on one more about their accounts of how difficult it is to receive care, maybe how far they travel to come to our clinics, only further emphasize this barrier to me. So I really appreciate the work that we do at these clinics, but I think it's a bit of a band-aid solution, and I recognize that lack of health coverage isn't a problem that's unique to Augusta alone. It's a problem that a lot of Georgians face, and so this is one of the key barriers that I noticed, at least initially, during my first year and a half in Augusta.
Yeah, my son's specialists, they start about 30 minutes away. And as I stated before, the ones that he goes to see on a regular, at least 2 hours away.
Do you find it difficult for you to be able to make the doctor's appointments and while also making plans or arrangements for your other children? Do you feel as if that is difficult for you and being able to get your child the care that they need?
Well, I'm just so practical in mind. Honey, all my kids, I just packed them up. We're taking a day whenever my son has appointments. So we just all just go. But I'm so thankful that I do have transportation to get back and forth. But we had an instance when my youngest daughter, she was born, she had heart surgery. And I did not know that Medicaid services would take us way from Atlanta back here. So that's over a 2 hour drive. But they did make accommodations and they did let me know, like, hey, we can take you these distances with using the Georgia healthcare system. So that was a plus with it. And they did also inform me about the different transits and stuff that you could use. But I've heard complaints from other people in the area about the lack of drivers that we have. So they their appointments sometimes they're late. They're trying to get back and forth. So like I said, thankfully I'm not having to deal with transportation issues, but it's a lot of other people in my area who do deal with transit
Yeah.
issues.
Finally, we spoke with Dr. Toby, a hospitalist and faculty member at Emory University. He sits as the board chair for Georgians for a Universal Health Program and on the board of directors for Physicians for a National Health Program. He joined us in this conversation in a personal capacity. How do you feel, or what do you think could be done to address some of those challenges in terms of a provider shortage, or maybe bridging? I don't know. We could say maybe bridging some gaps. And what gaps do you think are existing there, and what could be done to change that, help shift that shortage?
Yeah, thanks for that question, Kaneda. I think that one of the things that can be done to kind of address some of these shortages is something that I know the state is working hard on, and that's recruiting more primary care physicians who will be trained and will stay in Georgia, and with a particular focus on vulnerable communities and especially communities in rural settings, but also urban communities as well. And the state plans to open a new medical school in Athens, which I think is going to be very exciting. And I think encouraging more providers who are trained here in Georgia to stay in Georgia and practice primary care and preventative medicine in Georgia, and also making Georgia the type of place that providers want to come to practice medicine. There was recently a Medscape article, and I actually had some students who were doing some surveys about the types of things that may make providers more or less likely to either stay or come back to Georgia. And the Medscape article listed Georgia as, I think, the fifth worst state to practice medicine, unfortunately. And so I think trying to address that and make Georgia an appealing place to practice medicine, because as Dea can attest, we have really great institutions, we have really great community members and really dedicated healthcare providers. I love practicing in Georgia, and we need to bring as many really great healthcare professionals to Georgia as possible.
Yeah. And Dea, I also want you to answer that question, but you've mentioned that you've lived in Georgia for 4 years. Is that right? 4 to 6 years. So in addition to that question, what influenced you to want to come and practice or learn how to practice medicine in Georgia? And then the question I asked Toby was kind of around the role of healthcare providers in addressing some of the shortage of providers and helping bridge some of those gaps. So your question is a two-part question. What influenced you to practice in Georgia or learn?
So I attended undergrad out of state, and my family actually relocated to Georgia after I started undergrad. So part of the reason why I did want to come back was to be near my family. And the other part was that, after my parents and my family moved here, I was able to learn a little bit more about Georgia, how diverse of a population that Atlanta encompasses, and then also all of these other wonderful communities. I personally had never been to Augusta before I started at Medical College of Georgia, but having been there now, I can definitely attest to the incredibly large community that is there, and the potential that MCG and its associated hospitals has, and kind of expanding health access in that area. So that was kind of what brought me to Georgia. But in terms of strategies to expand health coverage in Georgia, in terms of the physician shortage, I will say I don't really have a lot of knowledge in this area. But I do know that, like Toby mentioned, the state is putting in a lot of funding to try and recruit more physicians to come to Georgia. And then also there is a program that I know of called the Peach State Scholar Program that kind of helps incentivize students to practice in rural settings. And so this is another method that we can kind of draw new and upcoming physicians to areas that really do need care.
Paul is satisfied with the services he has received thus far. However, he shared some frustrations regarding the ongoing process required to maintain his coverage. Here's what Paul had to say about his experience with staying enrolled in Georgia Pathways to Coverage. Paul, you have previously mentioned that you are enrolled in Georgia Pathways to Coverage, and that program, from what you're saying, seems to be working for you for right now in terms of meeting your healthcare needs. But I do want to hear more about what the process for maintaining eligibility in that program has been like for you.
It's a nightmare. It is a nightmare. One thing is the website, and I know I've tried using from laptops. It's not just the device. I went to the library, used a computer there. It's got to be the system itself. It's not the devices I'm using, because I've tried on different devices. And to remain eligible, every month I have to show my qualifying hours, and which for me is just it's the exact same letter every time that says, I confirm that Paul Michael works for me at least this many hours a week. Da da da. Have any questions? Whatever. And I take a picture of it, and and I have to download it. But just getting signed on sometimes. Matter of fact, just this past weekday, this last Friday, I was trying to speak to an actual person, and it said that you hear a little recording that says, now you don't have to wait or whatever. You confirm your number, and we call you back. And then you hold a minute, and they come back on and say, well, currently everybody's busy, so you just had to call back later, and it hangs up. And so, I called back probably 5 or 6 more times, and finally I hit it to where I guess there was a slot, and it said, okay, they'll call me back in, you know, approximately an hour or what have you, and just sit around and wait for the call. Like the system will be down, like for maintenance. They said that they're doing, they're doing maintenance or updating the system, just about every weekend. Um, and and then when you actually get to it, there's sometimes that I can go in it and I hit upload and bam, it's done. And then other times you go in it and I do the exact same thing. Um, I hit upload and it'll sit there and just spin and spin and say, waiting to upload, waiting to upload. And I mean, after a while, you just give up. I mean, literally, you just have to give up and try another day. And I mean, it's ridiculous. And navigating the system itself, it can be very complicated because there's lots of little asterisk. It's got the asterisk that says this must be completed or whatever, and some of it can be confusing. And I can't imagine, an older person that has no idea, how to, you know, any kind of computer savvy or what have you, could handle it. Because I mean, if they didn't have somebody to help them out with it, there's no way that they could navigate the system. I mean, I know there's not. I've tried to teach my 78-year-old dad, how to go online and look up yard sales, and I can barely do that.
Yeah, Sherthea, I hear you are in agreement with some of the things that Paul was saying, particularly about having to go into the online portal and answer or respond to some of the questions that they're asking, and that taking time and maybe not always being as user friendly. Have you had those same experiences?
It seems like they update that website more than anything. And and then you end up getting locked out, and then they're telling you, hey, you have to go through all these different steps and stuff. It's a lot. So if you, like he said, if you're not tech savvy or even a little bit, you may very well give up. And the fact there are no offices around for you to go in and see or speak to anyone, and then you get on the phone and you go through the automated system, and then they take you through another automated system. It's before you actually. So
So
it's not.
so what I'm hearing is as you all are going through these steps, it's difficult for you to actually get to speak to a live person, get somebody on the phone. Do you feel like that would be more helpful for you to speak to a live person,
Yeah,
or
if they're
yeah.
going to be able to access what we need, and but since they don't have an office anymore, where I'm at, we don't have an office at all. So if you're going to even speak with anyone, they're sending your paperwork all the way to Atlanta. So we're
Mm.
having to wait from a representative from the Atlanta area to contact us and let us know, yeah, we'll have an appointment scheduled for you, and God forbid if you miss their phone calls,
Oh yeah.
how are you going to get back, back that appointment? So
Yeah.
wait a little
Yeah.
longer for it. So it's, woof.
It's not unusual for Georgia Medicaid participants to face challenges maintaining their necessary care. Both Dr. Toby and Paul discussed instances where coverage was either jeopardized or completely lost, each due to distinct reasons.
One story that particularly stands out to me was a young woman with a pretty debilitating autoimmune disease, but she fortunately was able to get access to a medication that kept her disease under control for many years. And she got this medication through the Medicaid program here in Georgia. And unfortunately, she lost access to her Medicaid. And when that happened, she also lost access to her medication. And you could very clearly see when she was telling the story what an impact this had on her life. Instead of being able to kind of be the family member that she wanted to be the employee that she wanted to be, she really transformed into more or less a full-time patient, where she was coming to the emergency room. She spent many nights in the hospital. And it just really drove home for me how much the ability to access the care that you need has on not just your health, but also your overall life. And she found it very hard to maintain employment when she was not able to get her medications and when her disease was flaring like this. And it really, I saw the cycle. I saw this vicious cycle where her chronic illness made it hard for her to find work, which then made it even harder for her to get access because she didn't have employer sponsored health insurance, which then made it so her chronic disease was less well controlled and made it even harder to work for her. And this cycle drove home, I think, a lot of how I see the importance of healthcare access here in Georgia.
Yeah. Are you at liberty to share how this particular individual lost their Medicaid coverage? Was it through an unwinding, or was it just through an application glitch?
Yeah. So I think that unwinding was ultimately what led to the insurance lapse. I think also some personal circumstances had changed. I will say one of the great things that the state of Georgia did was extend postpartum Medicaid coverage. And I believe that that's how she was receiving her Medicaid previously. But then she did lose her coverage during unwinding.
Yeah, I was they were fixing to cancel me because they said that they didn't receive some information or something that on my end that I didn't do, and so I was actually trying to file an appeal. That's what I was doing, is going through the process to start an appeal. And luckily I spoke to somebody that that she was able to pull everything up, and she said she didn't understand why somebody dropped the ball or something somewhere, and she took care of luckily, thank the Lord. um you know she assured me that I didn't have to do an appeal, but she verified that everything was correct, and she said there was nothing on my end that I did wrong whatsoever. She said it was something with the system. She said, yeah, and if I wouldn't have went back and crossed every T and dotted every I, and made sure, go back and confirm, I would have lost my coverage.
Georgia Pathways to Care has a work reporting requirement that is proving to be an unintentional barrier to care. I asked Paul to describe the process of reporting his worked hours and just how long the process takes.
If everything goes as it's supposed to, it takes an hour or so. If everything's perfect, on my end is not the problem. It's just the actually getting it in the system. That's where when the nightmare comes on. It may be, you never know. It might be right at sign on. Just trying to sign in. It might not recognize your password, or I was dealing with an expired password last time. I needed to update my password or whatever. My password had expired, and I needed to reset it or what have you. And that took well, it was during the week, and it took into the next week before I actually got taken care of. Before I actually spoke to somebody, and she actually sent me a link that I could was a temporary password, and I had to go through all that. You know what I mean? It turned into days. Literally. And constantly going online. Taking all this time. And then like I say, and all that. It can multiply. Again. Just getting signed in. And then so you never know. It might be right at sign in, or everything might go real smooth, and it comes time to download, and you say click on the download, and everything's working just right, and this is waiting for upload, and you just sit there and watch the thing spin, and it never uploads. And so you try another way. You try to actually just take a picture of it right then, manually, and hit upload, and sometimes it takes it, sometimes it don't. Sometimes that works, sometimes it won't. Sometimes you just have to just give up and try back another day when the system's running smoother. I guess I don't know. I guess it's got its quirks. like I say, I've tried from different devices. I've tried from laptops. I've gone to the library,
Yeah.
used their computer, thinking that maybe it was, you know, I know, and but I've suffered the same problems regardless of the device. So I can assure you that it is not just me. It's got to be something with the system.
Yeah, thank you for painting that picture of just how much time it takes for you to go through that process. And also, I imagine it can feel frustrating at times, especially when you're following the steps, but it just isn't working out the way that it should be. Both Hridaya Shah and Toby have carried out comprehensive research on the efficacy of Medicaid programs and their work reporting accountability policies in particular.
Pathways, the program that was launched last July, was popular, and it was discussed a lot in news articles. And so a lot of this research just focuses on kind of looking at work requirements and similar policies to what Georgia's Pathways looks like, to kind of analyze the outcomes of those policies and then see the similarities and differences and how they line up with Georgia's Pathways. So as a part of the research abstract, we just examined literature and grade literature reports from places like Kaiser and Georgia Budget and Policy Institute, and then also the Commonwealth Fund. And we looked at literature to better understand the implementation of these work requirements and their impacts on Medicaid enrollment and employment rates, especially in states with prior waiver approval. So these waivers were approved by CMS back during the Trump administration. And on further examination, we found that only 5 states, except for Georgia, had implemented these work requirements. And these states include Arkansas, New Hampshire, Indiana, Utah, and Michigan. And so although each of these states had slightly different policies and there were some nuances, the work requirements were kind of the salient feature of all of these policies that we looked at. And so Arkansas was the only state that actually disenrolled Medicaid beneficiaries as a result of the work requirements. I believe it was roughly around 18,000 that they disenrolled. However, states like New Hampshire and Michigan were also set to disenroll a good number of beneficiaries. I believe it was 17,000 and then 80,000 for Michigan. But the programs were suspended before they could disenroll any beneficiaries. Indiana and Utah did have work requirements. However, the rollout of these programs was a little bit more complex just because of the COVID-19 pandemic. And also Indiana had a bit of a slower ramp up period, and they suspended their policy before it could fully go into effect. And so looking at all of these programs together, low public awareness of the policies, complex reporting requirements, and other factors kind of contributed to some of these high projected or actual disenrollment rates and non-compliance of the work requirements. Furthermore, we didn't really find any evidence in the literature to suggest that these work requirements actually resulted in an increase in employment or community engagement in Arkansas, which is the state that actually had the implementation of the work requirements for a substantial amount of time. And in addition to that, more than half of the beneficiaries that were affected and that lost coverage as a result of these policies in Arkansas were more likely to have difficulty paying off medical debt and also delay access to care or prescription medication as a result of their losing coverage. And anecdotal data from New Hampshire actually suggests that individuals there actually struggled with this as well. However, they were concerned about it should they have lost coverage. And so kind of tying these policies back to Georgia and Pathways, we can see that Georgia's Pathways currently has about 5,000 individuals enrolled, which falls short of the estimated goal of 100,000. And it's been enrolling individuals for about a year and a half now. And we can see that some of the barriers that affected these other states might also be impacting Pathways, just the complex documentation requirements, some of the other barriers in accessing the policy or having knowledge of the policy. And so our research kind of suggests that these work requirements reduce the impact of Medicaid expansion and they increase administrative costs. They create further barriers in access to health coverage. And so in terms of next steps, it would kind of be worth exploring how to modify this policy accordingly to be able to expand coverage to more.
Yeah. Toby, do you have anything to add to that?
I think that Dea did a great job summarizing the findings and also kind of the rationale for why we wanted to look at this. I think when we're talking about expanding healthcare coverage through whatever means, if it's Medicaid expansion or if it's ACA marketplaces, whatever it is, I think we want to find ways that we can maximize the number of people who are able to get coverage and access care through that program. And so I had read a lot about some of the work requirements in Arkansas and other states, partly through work that GHF and educational materials that GHF put out there. And so when Dea approached me with this idea, I thought this was a really important thing for us to look at.
Sherthea spends so much time seeing various specialists for her son. I wanted to know what the preventative care for herself and her other 3 children looked like. Sherthea, I've got a question for you. Knowing that you are the primary caregiver for all of your children, do you find that it's difficult for you to be able to access just preventative care just for yourself and even for them? Maybe you, most likely because you are making appointments for all of your children and making sure they've got transportation to those appointments. And I know you said when one child has an appointment, it's a full day. It's a outing for the whole family. Do you feel like you are able to access the preventative care that you need outside of the caregiving that you're doing for your children?
The options are few here in this area. So, of course, with having as many kids as I have and me being literally the sole person for them all, it's difficult because I would have to travel. Like I said, in this area is they can refer you to other places. So a case in point, an example, they just finally, after all these years of me going to my local providers and them just telling me, oh, it's just stress, they finally diagnosed me with anxiety. So, with that, they wanted me to go and see a cardiologist. And though we have a heart specialist here, they wanted me to go further. So I was like, okay, now I got to try to figure out how am I going to actually get this appointment? Do they accept the insurance that I do have since I'm having to use, Medicaid or Medicare? Do they even accept this? If they don't accept it, now I have to go further. Do they have any appointments to fit me in? Because they probably already have a full schedule. So I mean, the access is there, but how easy it is accessing it, that's the problem. Yeah.
Thank you for sharing that. Do you feel like because you are having to navigate the Georgia's healthcare system and go through all of these steps with the hope that they will lead to you being able to get an appointment or your child being able to get to an appointment, may have led to some of that anxiousness that you are feeling, that has brought you to this point today?
Well, I know that it is not the main thing, but I know that it has contributed to it because, as I stated,
Yeah.
with the many pre-authorizations and with the rareness of his disease, he literally, well, about 2 years ago, they had only 15 cases, and he's literally the only case in Georgia. It's only one Google page at the time about it, like one small article about this disorder. So, with the lack of knowledge on the doctor's parts, on my part, basically anyone who heard of the disorder, it was like, who can I turn to? And I'm not gonna lie, I felt like Georgia's healthcare system has literally decided, hey, if it's not one of the things that we just know about, we're not gonna go as far as to make ourselves knowledgeable
Yeah.
on it to show,
Yeah.
yeah,
Do you feel like
So,
you have to maybe push a little bit each time you're going to those appointments to
yeah,
advocate for yourself?
I have become an advocate for sure. They see me, they know that's Miss Jackson. So yes.
That's good. Sherthea and Paul are both handling a lot, and you could hear the strain in their voices. Sherthea even mentioned her anxiety disorder. This led me to ask them about their access to mental health services. You're in Peach County, Sherthea, and Paul in Henry County. Do you feel like you have access to like mental health care should you need it? Because there are some significant challenges with access to mental health care in our state, and I know that there are significant strides to being made. But can you all explain a little bit about that? Sherthea, I'll start with you, and then Paul.
Well, for one, it's not many mental health services that the people look like us, for one. So trying to find ones who do look like us, who I feel like could relate to us better, it's very hard because you're gonna pay more money because you're gonna have to travel a little further, and
Yeah,
the apprehension with even going to certain people because they don't understand exactly what you're going through. So it's mostly just the fact that we have one facility, and the facility that we do have, it may be a bit underpaid, a bit understaffed, and people are kind of getting grouped in
yeah,
together. And you don't want that. So you want the best treatment, and the best treatment is miles away from where you live. So it's kind of like you're stuck between a
yeah,
rock and a hard place. Back to the access is there, but how exactly are you going to go about accessing
yeah.
the care?
Yeah. And all of these steps can lead to just maybe burnout, just maybe feeling just tired of having to navigate the process in the system. And so I wanted to ask that question because all of these steps can lead to, can kind of compound in a way and make it, maybe difficult for people to want to even navigate it at all. And so, what about you, Paul?
Well, I'm actually attempting to do so now. Like I say, I've been Googling about how to go about doing it because I'm not for sure. Like I said, I haven't gotten a straightforward. When I spoke to my primary care, I told her about the stress I was under, and I'm just kind of dealing with PTSD. I mean, that's I can recognize it, and she really didn't say anything one way or another. So that's
Mm-hmm.
that's kind of a question I have right now currently. I really don't know how to access that care, and I'm trying to find that out. Because I feel like I could definitely I could use something like that. I don't know, maybe I might need some kind of medication
Yeah.
or what have you, or just to talk to talk to a counselor, a professional or something, about dealing with it, because I know there's times that I have panic attacks, and I mean I know it's got to be PTSD. I mean from what I hear others say, that's been diagnosed with it before, it's
Mm-hmm.
definitely what it is.
Access to healthcare is truly invaluable. Sherthea discussed assisting the elders in her family, while Paul talked about helping his dad. Additionally, medical professionals have also weighed in on this crucial topic.
Well, honey, I'm an introvert, so I really don't deal with too many people, to be honest. But with the elderly people in my family, after I find something out or I learn about it, then I feel like I'm obligated to help them because I mean, they're not going to be able to get through if somebody doesn't help them. And like I stated before, and like Paul stated, a lot of the places you call, you're constantly being told to call back or this, that, and
Yeah,
another. And I know personally, my grandmama, she gets beyond frustrated. And she will say,
yeah,
I'm not going to keep calling these people. I'm tired of waiting on them. I'm tired of dealing with it. So I've kind of had to jump in and be not her uh, caregiver or anything like that. What I could say, mediator. I hate to say
yeah,
it like
yeah, that's what I was getting at.
her mediator in situations like this when it comes down to help with her health care or whatever. So
Yeah,
yeah.
that's exactly what I was getting at. Like, do you find yourself also having to fill in some of those gaps for your family or for those in your village while also doing that for yourself?
So I think that having access to health coverage is an incredible privilege. I think it's something that it's easy to take for granted. It's something that I don't really think that much about. I think unless I'm actively putting my attention on it, just because it's not something that's on my mind as a concern or a worry. And so incredibly it's been incredibly important to make sure that others have that opportunity, or at least to do my best to make sure that others can have access to care.
Yeah, I think honestly, Dea said it all, and I do think that it's something that I actually don't have to think about all that much personally, which is a privilege, just like Dea said. It's a privilege. I'm fortunate to not have many chronic illnesses that I have to see many providers for, and so I think not having to think about or worry about how I'm going to access healthcare is really a privilege and something that I would wish for everybody. And I think Dea did a great job um, hitting home on that.
Yeah, it definitely influences how you show up as a provider and also as a health educator and advocate when you do have access to care. And so it's nice that where you can have conversations and really recognizing that privilege of having access to care and again wanting others to be able to access it just as much as you and really fighting for that in your work. Our guests today all shared insights that taught me something valuable, and I hope you learned something as well. You can support us by following GHF's digital platforms on Facebook and Instagram at Healthy Future GA, or visiting our website, healthyfuturegA.org, where you can learn about our policy and advocacy initiatives and other ways to meaningfully contribute to GHF's work. As we wrap up today's episode, I'd like to thank our guests and our listeners for participating in this important conversation. I'm Kanetta, and thank you for listening, and I hope you'll join me in GHF's mission to advance access to care for all Georgians. Cheers to a healthier future.